takes care of another illness. The greenish apple that is not up to yellow, that brings out gum, takes care of the female or male that that they have water coming out from their breasts, but they are not breastfeeding. So for that makes us, all those plants, every plant has time for a particular illness. That makes us that at very particular time we harvest the plant, package it in a mat. A mat is a mulcher. Remember that why our people use ordinary mat to sleep. It's not that they don't see any other thing to do mat. But mat takes care of heat. If you're having internal heat, and we use it to protect, to preserve the herbs. And in the body of the plants, you will see that the date of the harvesting, the date that we harvest the plant, is written there for each medicinal plant. So this herbarium have attracted so many higher institutions, because some people will know that Star Apple will do this, but they don't know that it's not when you are having dysentery, you pick it at the wrong time. Every plant has time. Even in these plants that you are seeing, some plants, those plants that are sleeping in the night, once it's 6 o'clock, you see them sleep. It helps for insomnia. You pick it that time that it closes, it will work another thing. And that time that it's open, it works another thing. So that's the extent of having this herbarium.
Center for Herbal Studies or Department of Diagnosis. This center was set up as a research and study center on herbs and herbal treatment as practiced by our forefathers, who used various herbs for their medicine, cosmetics, and as food. To keep aglow the practice of phytomedicine, which is as old as man.
See these combinations, like sample 2 contains magnified 8.2, contains alkaloids 2.75, saponicide 12.02, glycoside 9.75, protein 19.8, tannins 5.95, flavonoids 11.8, and carbohydrates 1.9. So when you see all these combinations in these results, you can combine sample 1 and sample 4 or 5 to achieve the result you want in the treatment of an ailment. That's the essence of the crude sample analysis. And it creates a safe background, because when you are administering the drug, you know exactly what they are giving. You know whether the drug is going to have a side effect or whether it's not going to have a side effect. That's the essence of the drug analysis. Because you don't administer blindly. You must know what you are doing, and you must know how to do it. You must know how to combine. That's the important thing in herbal medicine. The essence of combination of drug A and B and C to achieve a required result and end result in the safe treatment of an ailment.
If somebody have constipation and frequent urinate, how do you manage to find out the herbal that can control it immediately?
Fine. The patient has constipation. It has to do with the digestive system. The person has frequent urination, which has to do with the urinary system. Then you go back here. For the kidney and urinary system, you look for diuretic drugs. For the digestive system and colon, you look for laxative. So any herbal product that is laxative you can mix it with the herbal product that is diuretic to flush the system.
It's one of the problems that herbal products have. I want to clarify. This chemical analysis for some herbs, how long will it stay before it will expire?
Because biological action will set in, it starts, changes color, changes so many things. So the expiration is very fast. That's why when you boil medicine, you administer it immediately. But in teas, the expiration takes more than 6 months before it can expire, even up to 1 year.
This center has hosted several study groups like the final year students of the Faculty of Pharmaceutical Sciences, University of Nigeria, Nsukka. The center is also a home to pupils in search of knowledge and understanding, among whom were the pupils of Ibunidio Secondary School, Benin City, Edo State. Also, the overseas trained Nigerian pharmacists used the center for orientation before they were granted license to practice.
May I, on behalf of Pharmaceutical Sciences Faculty of University of Nigeria, Nsukka, the Dean, Professor Ago, and myself, Dr. Mrs. Inyaga, and the staff of Pharmacognosy Department in University of Nigeria, Nsukka, thank you for the opportunity you have afforded us to carry out a very crucial task that the Pharmacists Council of Nigeria has thought very important in the process of registering pharmacists that have been trained abroad. And this Center for Herbal Studies, the best of its kind, east of the Niger.
International agencies and foreigners are frequent visitors to the center. Notable among them are Don Manuel Cacho Questa, the ambassador of Spain to Nigeria, Dr. Anna Wu from Shanghai, Professor Lisa Mesro from USA, and others. UNDP, World Bank, and UNIDO have all sent study groups to the center. She also runs a nursery primary school where pupils learn the art at an early age.
To tell you about pumpkin. Pumpkin is rich in vitamin A, also contains potassium, sodium and phosphorus, value in tropics for its clean properties, prevent cancer, strengthen the eyes, maintain food balance, sometimes used in place of pumpkin seed for urinary or prostate disorder and to get rid of fountains.
I want to tell you about walnut. Walnut is unsaturated fat, protein, carbohydrate, vitamins and minerals. Very good for the heart and brain. Reduces risk of heart attack. Thanks.
I want to tell you about papaya. Papaya is rich in sodium, magnesium and vitamin A. Also contains calcium, potassium, magnesium, vitamin B, vitamin C, vitamin D, vitamin E, vitamin G, and vitamin K. Prevents cancer, releases gas and sore stomachs, expels worms, heals ulcer, aids digestion. Dry fruit eating daily gets rid of constipation. Thanks.
I want to tell you about banana. Banana is exceptionally rich in potassium. Also contains vitamin A, vitamin B complex, and vitamin C, easily digested, mildly laxative. Carbohydrate is readily absorbed by the body, good for infant feeding, in reducing diet, for combating acidosis, for intestinal disturbance, controls blood pressure, lowers blood cholesterol level, stimulates liver and kidney. Thanks.
Lemon is high in potassium, calcium, vitamin A and vitamin C. Used for rheumatism. Help. AWKA is rich in calcium, iron, phosphorus, vitamin B. Tried best. Strengthen the eyes. I am going to calcium, iron, phosphorus, saturated fat, promotes healthy bones, joints and muscles, good during infant teething. Coconut water is rich in magnesium. Thanks. We want to tell you about guava. Guava is astringent, antioxidant, antibiotic,
controls bleeding, lowers blood sugar level, boosts sensory, diabetes, malaria and cough, anti-carcinogenic and anti-HIV properties as reported by literature studies.
We are going to tell you about tomato. Tomato is rich in carotenic acid, also contain potassium, phosphorus, calcium, sulfur, vitamin A, vitamin C, vitamin K, and lycopene, who protect the cell of the phosphate, aids digestion, promote healthy skin, recommended against prostate disorder stress.
I want to tell you about granite. Granite is high in potassium, magnesium, vitamin A, vitamin B1, vitamin B2, and all the essential amino acids.